Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Cor pulmonale and its causes. So there are various headings we need to know this under. So the first one is the disease of the pulmonary parenchyma. So it is a disease involving the pulmonary parenchyma. So this includes the COPD, that is a chronic obstructive pulmonary disease. Next is the diffuse pulmonary interstitial fibrosis. So diffuse pulmonary, let's write it down. Diffuse pulmonary interstitial fibrosis. Next is presence of the pneumoconiosis. So there is also the pneumoconiosis, and there is also the cystic fibrosis. So this presence of the cystic fibrosis as well as the bronchiectasis. So there is the bronchiectasis also which is involved. Then we move on to the disorders of the chronic alveolar hypoxia. So herein the disorders of the chronic. So you look for the chronic the alveolar hypoxia. So in terms of the chronic alveolar hypoxia, it includes the obesity hyperventilation syndrome, the obesity hyperventilation syndrome, and also the central hyperventilation syndrome. So there's obesity hyperventilation syndrome, the central hyperventilation syndrome. Then there is a neuromuscular respiratory failure. So there's neuromuscular, there is NM, respiratory failure. There is some chest wall disorders. So there is involvement of the chest wall. So in terms of the chest wall, there are some chest wall disorders such as the kyphoscoliosis. So it is known as kyphoscoliosis. And there is also the chronic exposure to the high altitude. So in terms of chronic exposure, and this is to the high altitudes, so very high altitudes. Now let's look at the diseases of the pulmonary vasculature. So now we are looking at the diseases of the pulmonary vasculature. So in pulmonary vasculature, it includes the primary arterial hypertension. So primary arterial hypertension. So this involves, it can be idiopathic, it can be heritable, as well as it can be drug induced. So it can be drug or the toxin which is induced. And there can be a veno-occlusive disease as well. So it can be the veno-occlusive disease. Next is the chronic thromboembolic pulmonary hypertension. So it can be the chronic thromboembolic. So chronic thromboembolic pulmonary hypertension. And next is the involvement of the pulmonary tumor thrombotic microangiopathy. Thrombotic microangiopathy. To learn and grow daily like this, please do subscribe.